Hi there, and welcome back to Lean Reds, the channel where we share powerful insights and personal growth lessons through great books. What if some of the most common medical practices we trust are actually based on weak or outdated science? In today's video, we'll explore Blind Spots by Dr. Marty Makary, a book that uncovers the hidden flaws in modern medicine and challenges us to think differently about our health. If you enjoy what you hear and want to dive deeper, we've included a link to the book in the description below. Now, let's get started. Blind Spots 2024 examines the medical missteps in understanding and addressing major health issues that have led to widespread negative consequences for communities. The book highlights the dangers of herd thinking in healthcare, exposing misconceptions such as the opioid crisis and misleading dietary guidelines. At the same time, Blind Spots advocates for a more transparent, evidence-based healthcare system by delving into critical topics such as nutrition, reproduction, and the microbiome. It reveals the knowledge gaps in today's medicine that continue to impact patient outcomes. Marty Makary, MD, is a surgeon and professor of public health at Johns Hopkins University. He is widely recognized for his expertise in healthcare reform, patient safety, and medical transparency. He is also the best-selling author of The Price We Pay and Unaccountable, books that address the soaring cost of healthcare and the urgent need for accountability in the medical field. Recognizing outdated medical advice, we cannot deny the remarkable progress modern medicine has achieved. Yet many widely accepted healthcare practices today are still based on outdated theories or incomplete evidence. Over time, medical experts have issued recommendations that later proved to be poorly supported, creating a significant gap between what the public believes to be true and what science actually demonstrates. From nutritional guidelines to standard medical treatments, blindly trusting outdated information can cause serious harm to public health. But why do seemingly reasonable ideas so often turn out to be flawed and obsolete? In this condensed review, we will explore several areas where modern medicine continues to fall short. We'll examine the alarming rise of peanut allergies and how misguided advice contributed to it, along with the hidden dangers of antibiotic overuse. We'll also take a closer look at misconceptions about cholesterol and heart disease, outdated childbirth practices that still affect the health of both mother and child, and how media-driven panic over breast implants distracted from the escalating opioid crisis. Now, let's begin with the troubling rise of peanut allergies. Medical misinformation and the peanut allergy epidemic. In the late 1990s, peanut allergy was still rare, affecting only about 0.6% of children in the United States. Yet only a few years later, by 2004, the picture had changed dramatically. Schools began banning peanuts, and emergency hospitalizations for peanut reactions surged. A big question emerged. Why did peanut allergy explode in the US while remaining almost non-existent in other parts of the world, such as Africa and the Middle East? In 2000, the American Academy of Pediatrics (AAP) advised that young children should avoid peanuts until age 3, believing this would reduce allergy risk. However well-intentioned, the guidance rested on weak evidence and even ran counter to established immunological principles. Experts like Dr. Rebecca Buckley argued that early exposure to allergens, including peanuts, can prevent allergy by helping a child's immune system develop tolerance. Even so, the AAP's message dominated, and pediatricians across the U.S. adhered to a mantra of no peanuts for infants. Meanwhile, in rural Tennessee, pediatrician Stephen Combs, taking Dr. Buckley's counsel seriously, encouraged parents to introduce peanuts early. His patients thrived. None developed peanut allergy, while rates elsewhere climbed at an alarming pace. Immunologists such as Dr. Gideon Lack continued to challenge the avoidance advice. He observed that Israeli children who commonly snack on peanut-based foods had significantly lower allergy rates than children in the UK, His landmark 2015 clinical trial confirmed the pattern. Early peanut exposure reduced the risk of developing allergy by up to 86%. Despite recognition of these findings, the fallout from the initial AAP guidance had already spread, with lasting impact. Peanut allergy soared, affecting an entire generation and forcing families to live with constant vigilance and anxiety. For children with severe peanut allergy, daily life became a battle against accidental exposure and the threat of anaphylaxis or potentially fatal reaction. Even after the AAP revised its recommendations, many parents continued to avoid peanuts, unaware the guidance had changed. If you're a parent, staying up to date and critically evaluating health recommendations is essential early. Introduction of common allergens like peanuts may be an important step in protecting children from life-threatening allergies. The takeaway is clear: always question medical advice, especially when it lacks strong scientific footing. Trust the progress of science and make a habit of seeking accurate, up-to-date information. The hidden dangers of antibiotic overuse. Chris's story, a teenager plagued by persistent abdominal pain, reveals a troubling reality about antibiotic overuse. When Chris went to the hospital, no doctor could identify the exact cause of his discomfort, yet his medical history pointed to a likely culprit: a severely disrupted gut microbiome. Over the years, Chris had undergone multiple rounds of antibiotics. This repeated use had unintentionally wiped out not only harmful bacteria, but also the beneficial microbes in his gut, leaving him vulnerable to infections and triggering long-term imbalance. Chris's case is not unique. It highlights a widespread and concerning issue: the casual, often unnecessary use of antibiotics. While antibiotics are often viewed as safe and harmless treatments, the truth is they carry significant risks, particularly for the gut microbiome, which plays a critical role in digestion, immune health, and even mental well-being globally. The misuse and overprescription of antibiotics have reached alarming levels. Research estimates that nearly half of all antibiotic prescriptions in the United States are unnecessary, often given for viral infections that antibiotics cannot treat. The careless use of these drugs not only accelerates the rise of antibiotic resistance, a looming public health crisis, but also causes immediate harm by destroying beneficial gut bacteria essential for balance and proper bodily function. The misconception that antibiotics are entirely harmless has persisted for decades. Doctors often reassure patients that these drugs have no side effects, but the evidence tells a different story. Studies show that around 20% of hospitalized patients treated with antibiotics experience side effects, ranging from kidney complications to severe, life-threatening reactions. Even more concerning, antibiotic use, especially in young children, can lead to long-term and unpredictable consequences. A large study conducted at the Mayo Clinic involving more than 14,000 children found that those given antibiotics before age 2 were significantly more likely to develop chronic conditions later in life, including obesity, asthma, and learning disorders. The risks increased with repeated courses of antibiotics, underscoring the strong link between early exposure and long-term health challenges. To be clear, antibiotics remain essential and life-saving in treating certain bacterial infections, but we must acknowledge their hidden risks and guard against overuse. Misuse not only damages the gut microbiome and weakens the immune system, but also fuels the spread of antibiotic resistance, one of the gravest threats to global health. The takeaway is simple yet urgent: use antibiotics wisely, weigh the potential benefits against the risks, and don't hesitate to ask your doctor whether antibiotics are truly necessary for you or your family. The cholesterol and heart disease myth. The story of Uncle Sam, a 93-year-old man, vividly illustrates one of the most persistent misconceptions about cholesterol and heart health. For most of his life, Uncle Sam gave up his favorite food eggs out of fear that the cholesterol they contained would harm his heart. When he immigrated to the United States in the 1970s, doctors warned him that eggs, with their high cholesterol content, would clog his arteries and shorten his life for decades. He reluctantly followed this advice, believing the sacrifice would help him live longer. Uncle Sam's case reflects a belief that has been deeply ingrained in the public consciousness for generations, that dietary cholesterol is a primary cause of heart disease. Yet modern scientific research has shown that this connection is far from clear and has never been conclusively proven. For years, the medical community urged people to cut cholesterol and saturated fats in their diets to prevent heart disease. Much of this advice stemmed from the work of Dr. Ansel Keys, whose famous but controversial 7-country study suggested a direct link between fat consumption and heart disease. His theory profoundly shaped public health messages, government guidelines, and even the food industry, fueling the rise of low-fat, low-cholesterol diets. However, large-scale studies conducted in more recent decades tell a very different story. For example, a 2020 study involving 177,000 participants found that eating eggs and other cholesterol-rich foods had no significant impact on blood cholesterol levels or the risk of developing cardiovascular disease. In reality, cholesterol is an essential substance for the body, critical for building cell membranes and producing vital hormones. Despite this strong scientific evidence, the low-fat, low-cholesterol message remains deeply rooted in public perception and even in some medical advice affecting the lives of millions. Just like Uncle Sam, today we know that inflammation, not dietary fat, is the key driver of heart disease. Refined carbohydrates and added sugars, rather than saturated fats, are the primary culprits behind arterial inflammation. If you've been told to avoid cholesterol or fat, it may be time to reevaluate that advice. Instead, focus on eating whole foods, practicing portion control, and reducing refined carbohydrates to maintain a healthy heart. Now, in his 90s, Uncle Sam can finally enjoy his beloved eggs again. His story stands as a powerful reminder that questioning outdated medical dogmas can lead not only to better health, but also to a more satisfying life. Rethinking safe childbirth practices in the mid-20th century. Medicine embraced a highly clinical and intervention-heavy approach to childbirth, one that prioritized technology and medical control over the natural capabilities of the human body. For years, common practice involved clamping the umbilical cord immediately, separating mother and infant right after delivery, and performing a host of routine interventions thought to be essential for newborn health. Yet modern research has shown that many of these practices can, at times, do more harm than good. One striking example is the return of delayed cord clamping. This approach allows the umbilical cord to continue supplying the newborn with oxygen-rich blood, stem cells, and vital nutrients for 1 to 2 minutes after birth. Once largely abandoned, delayed cord clamping has now been proven to offer significant benefits, including reducing the need for blood transfusions in premature infants, improving oxygenation, and even supporting better neurological development later in life. While it has gained wider adoption in U.S. hospitals today, for decades, immediate cord clamping was the unquestioned standard of care. Another important shift has been the growing emphasis on skin-to-skin contact between mother and baby immediately after birth. For much of the 20th century, hospital routines often separated newborns from their mothers, placing infants in sterile nurseries instead. But clinical research has demonstrated that keeping babies close, especially through skin-to-skin contact, helps regulate heart rate, body temperature, and stress hormones, while significantly improving breastfeeding success rates. This natural bonding time has also been linked to a reduced risk of postpartum depression in mothers. One of the pioneers advocating for these changes is Dr. Arpitha Chiruvalu, a neonatologist at Baylor University Medical Center. Her strong support for delayed cord clamping and skin-to-skin bonding has led to measurable improvements for both infants and mothers. Her studies show that these simple, natural practices shorten ICU stays, reduce unnecessary medical interventions, and generally contribute to healthier outcomes for newborns. The over-medicalization of childbirth unintentionally overshadowed traditional practices that aligned with the body's natural rhythms. Today, by revisiting and reintroducing these evidence-based yet inherently natural approaches, the medical community is seeking a better balance, one that combines necessary medical intervention with respect for the innate process of bonding between mother and child. This shift represents a gentler, healthier way of welcoming new life into the world. Breast implants and the opioid crisis. In 1990, journalist Connie Chung aired a television segment on breast implants that unleashed a wave of public health fear across the United States. In the program, Chung interviewed several women who claimed that their silicone implants were the cause of debilitating symptoms such as chronic pain, fatigue, and a host of autoimmune disorders. Although scientific evidence supporting these claims was weak at best, the story captured widespread public attention and fueled nationwide anxiety. The fear quickly escalated into a public health controversy. Silicone breast implants became the target of countless lawsuits. And by 1990, the Food and Drug Administration (FDA) formally banned them. Thousands of women rushed to have their implants removed, often at great financial and emotional cost. The FDA's decision, led by then-Commissioner Dr. David Kessler, was made without clear scientific evidence, reflecting more of a cultural panic over cosmetic surgery than data-driven risk assessment. Regulatory action appeared to be driven largely by anecdotal reports and public pressure, rather than solid research, raising important questions about how health risks are communicated and managed. For years afterward, heated debates raged among physicians, patients, and the courts over whether silicone implants truly caused autoimmune disease or cancer. Meanwhile, scientific studies began to emerge that steadily dismantled the alleged link. By the late 1990s, independent research conducted by the Mayo Clinic and the U.S. National Academy of Medicine found no evidence that silicone implants caused the diseases attributed to them. These findings eventually led the FDA to lift its ban in 2006. By that time, however, the damage had been done. Companies like Dow Corning went bankrupt under the weight of lawsuits, and public perception of breast implants had been deeply scarred, an image that remains difficult to reverse. What is particularly striking is the contrast in regulatory priorities. While the FDA devoted extraordinary resources to investigating breast implants, it failed to apply the same level of scrutiny to opioids. Around the same period, OxyContin was approved with minimal oversight, paving the way for an opioid epidemic that has since claimed more than 1 million lives. This stark contrast highlights the dangers of misplaced regulatory focus, where unfounded health fears can overshadow genuine, large-scale public health crises. Today, silicone breast implants are considered safe when used as directed. Yet the echoes of the controversy serve as a cautionary tale about the power of media-amplified narratives and the critical importance of making medical decisions based on strong, reliable evidence. Other medical misconceptions. Decades ago, the medical community made a critical error in believing that melanoma, a deadly form of skin cancer, did not affect Black people. This false assumption had tragic consequences, most famously in the case of music legend Bob Marley, who died at the age of 36 from an undiagnosed melanoma. His death is a sobering reminder that even widely accepted medical truths can be dangerously wrong. It raises a pressing question: what other misconceptions might we still be clinging to today? One area worth re-examining is the practice of water fluoridation. For years, fluoramide was hailed as a miracle solution for preventing cavities, yet recent studies suggest a more complicated picture. A 2019 study found a link between high maternal fluoramide exposure and lower IQ scores in children. Moreover, much of the research supporting fluoride's effectiveness was conducted before 1975 and is now outdated. Interestingly, many European countries that do not fluoridate their water have still seen similar declines in tooth decay. Evidence also points to fluoride's potential effects on the gut microbiome and even brain function, raising the question of whether widespread fluoridation is truly a beneficial public health measure or a harmful one. Another misconception lies in the belief that cannabis is harmless. Today's marijuana contains far higher levels of THC, the psychoactive compound, than it did decades ago. Studies now reveal serious risks for adolescents who use cannabis, including higher rates of schizophrenia, depression, and suicidal ideation. Cannabis use has also been associated with increased risks of heart attack and stroke. These findings challenge the idea that marijuana can be safely regarded as a benign recreational drug. The routine use of Tylenol acetaminophen to reduce fever is also worth reconsidering. Fever is the body's natural defense against infection, yet our instinct is to suppress it immediately with medication. Research suggests that lowering fever with drugs can actually prolong illness. Instead of automatically reaching for antipyretics, we may need to appreciate the potential benefits of fever in certain cases. These examples reflect a broader issue in medicine, the persistence of dogmas, beliefs treated as truths that are anything but. Science is constantly evolving, and we must remain willing to challenge long-standing practices. Only by continually questioning and updating our medical understanding can we avoid harmful mistakes and ensure that health recommendations are grounded in solid evidence. Many of today's widely accepted medical practices rest on outdated, incomplete, or flawed scientific evidence, often leading to unintended harm, from the alarming rise in peanut allergies to the rampant misuse of antibiotics to persistent myths about cholesterol and heart disease. Each case underscores the importance of critically questioning conventional wisdom and demanding evidence-based medicine. Continually updating our knowledge and staying open to scientific progress is key to safeguarding public health and avoiding the traps of harmful medical dogma. Ultimately, the goal of Blind Spots is to empower readers with the knowledge and confidence to make informed, thoughtful decisions about their own health. Finishing Blind Spots left me with both admiration and unease. Admiration for how clearly Dr. Marty Makary lays bare the blind spots of modern medicine, and unease because of how often our trust in outdated or poorly supported medical advice can have life-altering consequences. What struck me most is how many of these blind spots were never malicious. They often began with good intentions. Doctors told parents to keep peanuts away from children, believing it would prevent allergies, yet it did the opposite. Physicians prescribed antibiotics as if they were harmless, unaware of the long-term damage to the microbiome and the rise of resistance. For decades, cholesterol was treated as the villain, while the true culprit, systemic inflammation, was overlooked. Even childbirth practices, once driven by routine interventions, ignored the natural rhythms of the human body. And in the 1990s, while regulators were laser-focused on breast implants, the opioid epidemic was quietly gaining momentum, devastating millions of lives. Reading these stories made me realize that medicine, like any human endeavor, is vulnerable to cultural pressure, media influence, and inertia. A belief repeated often enough can sound like truth even when the evidence is weak. Bob Marley's untimely death from undiagnosed melanoma, the panic over fluoride, or the casual acceptance of high-potency cannabis all serve as reminders that we must constantly revisit what we think we know. The greatest value of this book, for me, lies in its call to intellectual humility. Medicine saves lives every day, but it is not infallible. Science evolves. What was once best practice can turn into tomorrow's mistake. The responsibility, then, is twofold. Doctors must remain open to questioning their own assumptions, and patients must be proactive in seeking reliable, up-to-date information. For me personally, Blind Spots was more than a critique of the healthcare system, it was a lesson in how to think. It reminded me not to take medical dogma at face value, to ask better questions, and to remember that good health decisions require curiosity as much as compliance. In the end, this book doesn't just expose blind spots. It shines a light on the path forward, a culture of medicine that values evidence over tradition, transparency over fear, and above all, the well-being of patients over the comfort of old beliefs. The biggest lesson here is simple: medicine saves lives, but it is in perfect hand we need to keep questioning. If this book resonated with you, consider reading Blind Spots for yourself. Don't forget to like, subscribe, and share your thoughts in the comments. What medical myths have you questioned in your own life?